I am joined now in studio by Dr. Bill Thompson IV. He's a member of the Orange County Medical Association. Doctor, welcome to the program.
Thank you.
Now, we just saw a piece where a new study has indicated that even people that have had heart failure or are suffering from heart disease, that moderate exercise is actually a good thing to help them live healthier and happier. That's kind of the opposite of what we've always thought, isn't it?
Well, there were two groups of thought amongst physicians. One, should you exercise these patients after they've had heart attacks and have heart failure, or should you just rest them and just let them live a sedentary life? Intuitively, one would think exercise is a great thing, and you should do it. Dr. Catherine Flynn over at Duke did this great study that lasted a couple years, and they followed these patients, and they found that if you exercise them right after their heart attacks and with heart failure, it actually, very quickly, their stamina went up within about 3 months, and then that was their peak. And they continued on that level compared to the ones who didn't have exercise. Okay.
Well, what about the opinion maybe of some of your colleagues, people that you talk to in the medical industry? Do you think they're going to find the findings of this study maybe a little difficult to believe?
I don't think so. It's everything's really evidence-based now, and now we've got this great study that showed us absolutely exercise these patients, and I think that physicians we're pretty good about keeping up with evidence-based medicine, and I think you're going to start seeing a lot more cardiac rehab going on.
Okay, let's fast forward then to the patient.
Sure.
A patient has had a heart attack or has been diagnosed with heart disease. Is thinking, gee, every move that I make could be my last, so to speak. I'm teetering on this precipice. Do you think that perhaps this is going to be a tough sell to a heart patient?
It certainly can be, and often when patients have their first heart attack, it's such a surprise to them, and being in intensive care, that's a great place for your soapbox to get on and really talk about that. It hits home. Often they'll quit smoking after that. It's a great thing. But it's your relationship with your cardiologist and with your primary care doctor. You really get in and you really educate them, because knowledge is power with these patients, and they can really move on and have a better quality of life.
Do you suppose that we're going to have to see some kind of, with anything new, any new study, when you're trying to change habits or opinions of people, obviously education is key. Do you suppose that medical associations and hospitals and caregivers are going to have to undertake some kind of education program to teach people that, it is okay to exercise even if you have had a history of heart trouble?
Absolutely, and a lot of the hospitals now have really great education programs, usually run by the nursing staff in conjunction with the Cardiac Rehabilitation Center of each hospital. And right from the beginning, as soon as the patient's able to understand after their heart attack, they get right in there and educate. The dietitians come in and talk about diet. The physical therapists are right in there doing rehab right away, and along goes with that education.
Okay, if someone's watching our program, we got a real gung-ho guy. He says, okay, I'm getting off the couch right now. As soon as this program's over, I'm going out for a jog. What's your advice to him?
Hold back, absolutely. I'm not even sure jogging is a really good thing for you with all of the joint destruction, but work with your physical therapist, work with the cardiac rehab, and they'll get you right into a nice program. And even lifting weights, studies have shown, actually gets your heart rate up enough to really cause some good effect.
Dr. Bill Thompson IV, he's a member of the Orange County Medical Association. Bill, thanks so much.
You're welcome.